Tana River County get free medical help. Let's now take a look at how those in Uasin Gishu County are handling the situation even as the doctors' strike enters day 22. And joining us live with that is our reporter from Uasin Gishu, Elvis Gaskay. A very good afternoon to you, Elvis. What is the situation in Uasin Gishu? Elvis, a very good afternoon to you. Just keep us up to speed with the health situation in Uasin Gishu County.
Afternoon, Akisa. I'm at Uasin Gishu District Hospital. Earlier on, we were in several hospitals in Uasin Gishu County. We were in Turbo Sub-County, also in Kapseret, in Langas area, and Uruma area. And Akisa, precisely, we saw that more than 100 patients from this hospital were discharged yesterday from both districts and private hospitals and left to their own devices following the doctor's strike. And here at Uasin Gishu District Hospital, I just speak to one nurse who is on duty just to paint us the picture of the Uasin Gishu District Hospital. Thank you very much. Labda utuambie hapa hali imekuwa namna gani, kwamba tuliona madaktari bado wako strike, lakini nyie mko kazini na tunaamini kwamba kuna wagonjwa ambao labda wako katika hali mbaya. Hali imekuwa namna gani?
Okay, we still have few patients despite the doctor strike, but we hope they'll resume back soon. Some of the patients who are in critical conditions, we are not able to see them, but we keep referring them to Moi Teaching and Referral, of which we are not sure if they are going to get any benefit because doctors there are still on strike also.
Okay, what is the situation like as in before the strike and after the strike? Do you get many patients in the hospital? Do you have facilities to support the patients?
Okay, before strike, we used to have several patients because the doctors were there, available, but right now the doctors are not there. The patients are scarce a bit, but about the availability of maybe facilities, it's scarce because like when you have to refer a patient, they won't receive even the ambulance. It's hard to get because where we refer our patients MTRH, they are not able to receive our patients.
Okay.
Yes.
Thank you very much. Let's also hear from the chairman of Canaan Uasin Gishu branch, Mr. Simon Kibi. You have heard that the patients here really get difficult time in when it comes to be attended to by the nurses because of the doctor's strike. What's your word on this?
Actually, it is very critical because we expected that when the nurses got a deal, we expected soon after the doctors to also get a deal. But we are surprised that they are still on strike. There's no solution yet. And yet patients are suffering. In so many hospitals, patients are being referred to the Moi Teaching and Referral Hospital, which is a major facility in this region. But they don't also receive any care because doctors there are also on a strike. So there are those critical cases, maternity cases that require surgery. We have also patients who require surgery. We have also patients who require specialized care, and they cannot receive this care because doctors are still on strike. So it is really a very grim picture.
Okay. What are you doing maybe to contain this situation?
Of course, we will attend to those cases that do not require specialized care, but the rest of the cases, we refer them to other facilities, but in private hospitals. But also private hospitals, you heard that they want also to join in solidarity with their colleagues in government. So it may be actually a very critical situation if we reach there.
Okay. Thank you very much. We've heard from Mr. Simon Kibi, the chairman of Uasin Gishu branch, the chairman of Canaan Uasin Gishu branch. Like I told you before, Akisa, our spot check, we realized hundreds of Uasin Gishu residents were discharged yesterday in both private and public hospitals and left to their own devices. And that is the situation right now at Uasin Gishu District Hospital.
Quite an unfortunate situation there, but thank you very much for joining us. Elvis joining us live from the Uasin Gishu district.